Lipedema is a connective tissue disease where the connective tissue above the muscle and below the skin from about the waist down in women grows uncontrollably. So we have fat cells in our body, whether they're diseased or not. Somebody that has this, somebody that's skinny, somebody that's fat, we all have a set number of fat cells. And really, as we gain weight or lose weight, those fat cells are actually just getting bigger or getting smaller. So when you lose weight, you don't get rid of fat cells, they just shrink. The problem with lipedema is the fat cells from the waist down can grow, and as they get larger, they won't ever get smaller again. And that's part of the disease. We don't understand why. And then in addition, not only will they grow, they actually multiply, which again does not happen to other people. Again, our cells don't multiply, the fat cells don't multiply, they just enlarge. And that's part of the disease process that makes it very, very hard. And diet, exercise, nutrition, medications, we haven't found anything to change the nature of the disease other than surgical intervention. There's fibrotic connective tissue, there's lymphatic tissue, there's a lot of fatty tissue. And as that tissue grows, it becomes very disproportionate and it becomes very heavy. And so it starts to become limiting to function and it actually causes pain. Patients can be sitting and their legs are in pain. They can wake up and they're in pain. They could go exercise and they're in pain. So it becomes a very debilitating disease. The records show that it's associated with changes in estrogen. We think that there's probably a component of inflammation, but it's severely understudied and unknown. There have been some documented cases of men, but they have other genetic problems and typically their hormones are out of balance, hence the correlation. Again, it's associated with estrogen. And then usually changes in estrogen, like pregnancy, will cause it to just really ramp up. And so slowly over time, it progresses and it's not really appreciated or understood here in the United States. We don't have a blood test, we don't have an X-ray or an ultrasound or something like that that confirms the diagnosis. The disease was first characterized in the early 1940s, and it's a constellation of signs and symptoms. So certain types of pain and location, and then just the body shape. And so it disproportionately affects the lower part of the body. And so a lot of patients will be trim up top and in their trunk, but their lower body looks different. Obesity starts usually in the center part of the body and spreads out. And that's the subtle but important difference, is that with lipedema, it's extremely biased towards the lower body. And initially it was thought that about 30% of patients will have arm involvement. That number probably is more around 60%. And so what you'll see is a woman who, again, you look from the waist up, seems to be normally proportioned until she puts her arm out, and then there's this big, huge mass where their forearm is much bigger than what we would expect. And you say, that doesn't really fit with this. And then you start to ask, hey, are your arms sore? Oh, all the time. Well, what happens when they take a blood pressure? Oh, I can't even do it. It makes me cry. Most of us have had our blood pressure taken. You're like, okay, wow, that one's really squeezing pretty hard. But this is pretty intense because that pressure is affecting the lipedema tissue, and it's horrific for the patients. The only way that is known to control the disease, to stop it from progressing and improve pain and mobility, is to remove as many of the fat cells. We can't get the fibrous connective tissue out, but remove as many of the fat cells as possible, and that stops the disease. So without surgical intervention, the history and the current medical knowledge shows that the disease will continue to progress. Some women can survive their normal length of life, but usually in their 60s or 70s, the disease has progressed so far, it's very hard for them to walk, and they're sore and they're very limited. We don't teach it. It's not in the textbooks. I've taught at 2 different medical schools. It's not in the textbooks. It's not taught in the residencies. We just, in the United States, we feel that people that have enlarged sizes or are overweight are because of obesity. And the vast majority of the time that's the case. But there is a percentage, and it's estimated between 10 and 11% of women have lipedema.